I've always felt like there's kind of a revolving door over at our health agencies. Not that the people over there don't do good work, and some of them they're very dedicated. So I have great confidence in the FDA and HHS, but in certain areas, I believe that the pharmaceutical industry has too much influence. And I think that's true also because in the area of dental amalgams, those organizations that have a lobbying effort up here and have the ability to expend large amounts of money and maybe even offer some people some positions when they leave government, have too much influence. And that's been proven more than once before my committee. I'll give you a case in point. The rotoshield virus, which children have, we had the rotoshield vaccination. And they have what they call advisory panels that deal with these issues, whether or not a vaccination is safe or not safe. And one of the people that was on the advisory committee had stock in a company that was making a rotoshield vaccination against the rotoshield virus. And he had several other doctors on there that had concerns about it, but they weren't at some of these hearings, so they brought in people from the FDA and HHS to be on the advisory committee, and the vote was taken to say that it was safe, and they put it on the market. Within a year, several children had either died or been severely injured by that vaccination, and they took it off the market. And so I had the FDA before my committee, as well as the Health and Human Services, and I said, now tell me how many of these advisory committees make recommendations that you do not accept? And they said, well, we don't know. And I said, well, I know. None. You take every one of the advisory committee's recommendations and you go ahead and run with it, which means if they say something's safe, you put it on the market. And some of these people have never sent in the information that they're supposed to send in that tells us whether or not they have a conflict of interest. They're supposed to do that. And this doctor that was on there that had a financial interest in this vaccination was the guy that was the head of this advisory panel, which was accepted by the FDA. Now that's something that has to stop, but unfortunately it hasn't.
I agree.
Now I don't know if this makes any difference to you, but it shows the influence that is exerted from the outside on a lot of these issues.